Hi, my name is Mary Taylor, and I am interested in clinical research for several reasons. So first, I'm dually degreed. My very first degree is from the University of Connecticut. It's a Bachelor of Science in Molecular and Cell Biology with a concentration of genetics. I actually worked at Pfizer as a senior research associate, which is a scientist, for almost 15 years, specifically in the area of CNS, central nervous system, psychotherapeutics. That would be medications for depression, addiction, anxiety, things like that. So a lot of the compounds I worked on, things like Zoloft, I was able to see through fruition. And it was very interesting to see, follow the studies along, especially when you went from an investigational new drug or an IND into first in human, or the very first clinical trial. I left that field because I just didn't feel like I was doing any benefit, so I never got any gratification. And I came from a family of nurses, so I went back to school, I did a master's entry into nursing, and I got my BSN, and I was a critical care nurse, or ICU, from the get-go. Critical care nursing is very, very specific. You have to be extremely detail-oriented. Calculations have to be right on. Observation skills have to be spot on. Not only are you watching for the patient and what's going on with them, but you're watching for the doctor. So the intensivist is not there all the time. Sometimes you have, in certain hospitals, an intensivist who stays there, but a lot of times they're not. They go do rounds in the other hospitals or in the other ICUs. So it's very, very imperative that you keep your eyes on that patient. You look at their lab results, you draw their labs, you make sure any labs are drawn in accordance with any medication that they're on to check certain medication levels. You're constantly monitoring their vitals. You're looking to make sure that they are responding appropriately to treatment. So it's very, very important to make sure you have good observation skills. And lastly, the reason I wanted to get into clinical research is to kind of combine the two trades. So I'm used to drug development. I know what it's like. I know the blood, sweat, and tears that you pour into all the assays and the developments for a new drug. And then I've seen the other end of it too, when I've had people that have started on a relatively new treatment and my God, it's actually fixed their disease state and they've gotten better. And that's the kind of instant gratification that I didn't get with drug development. So I'm really hoping to start on a career that kind of brings the two together. And I think, from the precise measurements that I had to do as a scientist to the precise monitoring and the high organizational skills I needed as a critical care nurse. And also I worked in the ER too, will certainly benefit any research facility that is willing to hire me. Thank you.